Hello, this is our community health assessment project on the city of Long Beach. My name is Jade Anda.
My name is Gurman Dillon.
My name is Milani Lewy.
And my name is Lauren Sinks.
So in 2019, the total population of Long Beach was over 470,000. However, we expect some fluctuation in that number due to COVID. Long Beach is a part of Service Planning Area 8, which is comprised of cities such as Inglewood and Carson, and is known as the South Bay and Harbor. This spa has a total population of over 1,300,000 residents. The map on the right outlines Service Planning Area 8. Some of its major employers include the Port of Long Beach and the Veterans Hospital. The health department serves all 11 zip codes listed within the city of Long Beach.
Table 6 from the Long Beach Community Health Assessment in 2019 shows the key informant prioritizations of the community members who participated. For example, access to healthcare, chronic diseases such as diabetes, heart disease, stroke, and asthma, as well as mental health and public safety, such as crime and homicide, are really key important areas to address based on the survey responses of participants.
We decided to focus on the following top 3 health areas. First, asthma. 8.8% of Long Beach adults currently have asthma, while only 7.7% of Californians have asthma. The bar graph shows a percent increase above the LA County average of visits to the emergency department due to asthma, and shows that proximity to truck highways is a large risk factor. The next largest is proximity to Port of Los Angeles and Long Beach. Second, lack of access to resources. Just 82% of Long Beach residents have easy access to healthy food, which is lower than LA County's, which is at 90%. 30% of the population is obese. There are over 65,000 confirmed COVID cases and over 1,000 COVID-related deaths. Lastly, substance abuse. The rates of hospitalization for both substance abuse and alcohol abuse are greater in Long Beach than both Los Angeles County and the state of California. Long Beach has a rate of 15.3 hospitalizations due to alcohol misuse and a rate of 8.6 hospitalizations due to a misuse of substances.
In terms of the COVID data, approximately 317,161 people have been vaccinated. This data is very important because mostly populations of color were disproportionately affected by COVID-19, specifically being the Latino population. In the maps we see above, they're both separated by zip code in terms of COVID-19 cases and vaccination rates. Part of high COVID rates was racial clustering, in part due to redlining. And due to this clustering, social vulnerability and health risks were much higher, especially during the pandemic. Within these communities, there was a shortage of testing and a lack of timing for proper results, resulting in higher cases. Many of these communities were also immigrant communities. Immigrant communities comprise about 25.39% of Long Beach populations. And on February 24th, when President Trump made it harder for immigrants to obtain green cards if they sought housing assistance. Thus, it led families to relocate into smaller living spaces, making it more difficult to social distance and exponentially leading to new COVID-19 cases.
3 areas of community weakness we decided to focus on is location, proximity to Long Beach Harbor and freeways, which increases poor air quality. Number 2, major causes of death, both pre-COVID and currently. And number 3, food insecurity. Proximity due to the Port of Long Beach and freeways, as shown by the Cal and Biro screen heat map. Long Beach is in the very high end of poor air quality. And this largely affects asthmatic episodes. Number 2, major causes of death were between the years of 2013 and 2017 for females. Heart disease, cancer, and cerebrovascular diseases were among the highest rates of death. And in terms of male population, heart disease, cancer, and chronic lower respiratory diseases accounted for the 3 major causes of death. Homicide and assault were the 4th major cause of death in Long Beach. And 3, food insecurity is a huge problem in Long Beach, as the food insecurity rates for households and income levels less than 300% of the federal poverty level have a food insecurity rate that's 10% higher of that of LA County. Additionally, Long Beach has a lower percentage of easy access to fresh produce than the overall rates in LA County as well.
This is an example of food insecurity or food swamp near Cal State Long Beach. It's the largest four-year university in Long Beach. It severely lacks healthy alternatives or even grocery stores in its general vicinity. This is another example of food insecurity and food swamp. This is near the Veterans Hospital, which is an important part of the Long Beach community, as well as one of its major employers.
So 3 of the community strengths we decided to focus on was the percentage of residents participating in WIC, the number of asthma assistance programs, and COVID-19 testing sites, and cultural competency when it came to information on COVID questions and vaccinations. First, Long Beach has had almost 70% of WIC participation, which is a higher percentage of WIC participants than LA County. WIC allows at least part of Long Beach community women, infants, and children who met the criteria to have more access to fresh produce. However, due to COVID as of March 2020, they have been enrolling people over the phone. Second, because asthma rates are so high in Long Beach, the city has a large number of programs to help combat asthma and provide more services to support those with the illness. The care management program allows caseworkers to conduct in-home visits to find ways to deal with asthma triggers in the home. Last, in efforts to stop the increase of COVID-19 cases, Long Beach has provided access to free testing centers and information regarding vaccinations and general COVID questions in different languages. The Long Beach Health and Human Service website also gives information to health providers, essential workers, businesses, and schools on health mandates, CDC guidelines, guidance for reopening, etc.
Some notable programs to address these health outcomes are the CARE Project and the ALSAA programs, which both address asthma in adults, where they conduct in-home case management programs to reduce indoor pollutants. For children, the Long Beach Alliance for Children with Asthma addresses children asthma with goals to improve children's lives who are diagnosed with asthma. And a unique part of the program is it has a fight asthma tracker, which alerts patient when asthma danger and when asthma danger is high and highlights high pollution areas to avoid. For substance abuse, most notable programs is a PAD program, which is in partnership with the Los Angeles Centers of Abuse of Alcoholic and Drug Abuse. It works with the prosecutor's office to review all misdemeanor cases in Long Beach, and if a person has a mental health or substance abuse problem, the case is given to PAD, which works with LA CADA. This is also a certified substance abuse and behavior treatment provider, where it treats populations with addiction and behavior problems through a variety of client-centered approaches. And similarly is Safe Refuge, which also focuses on the same goals. However, the main difference is its family-oriented residential housing is dedicated to specialized treatment.
In efforts to better understand the community of Long Beach, we interviewed Officer Javier Valencia, who has been a part of the Long Beach Police Department for over 20 years. He notes that crime rates have increased dramatically, and this can be due to offenders who have been often released immediately because of COVID-19 restrictions and or no bail. He also notes that street gangs have made a tremendous comeback in the last few years. As we previously stated, drug overdoses, shootings, and homicides are really prevalent in the Long Beach community and have been the most noticeable increases in crime rates. Crime rates are also highest in the low-income areas and specifically in central Long Beach. And while mental health is not a criminal offense, he also notes that there have been an increase in mental health calls for service. Personally, he's not been involved with enforcing any COVID-related mandates. However, the department has been working with the health department in issuing citations to restaurants that were not complying with COVID-19 mandates. In his eyes, some positives of the community is the interdepartmental communication and planning that Long Beach Health, as well as the highly trained police force and fire departments, are resources to the community. He also sees city politics as a potential source of weakness in his own eyes.
So in summary, higher asthma rates in Long Beach adults can be directly attributed to the city's proximity to the Long Beach Harbor. Although this is an extremely prevalent issue in Long Beach, the city was pragmatic enough to provide numerous assistance programs. Having more asthma assistance programs is helpful, but does not fix the overall issue of high asthma rates. Second, a lack of access to resources reinforces overall food insecurity. Almost 20% of Long Beach residents do not have access to healthy dietary options. Over half of the students enrolled in Long Beach Unified School District are enrolled in free or reduced meals. Although this is another metric of food insecurity, the programs provided breakfast and lunch to almost half of the students attending these schools. Long Beach City Council also created a food security plan in order to help those in areas with grocery store closures from COVID-19. Lastly, alcohol misuse and substance abuse lead to overall increase in crime rates as well as violence within the community. The violent crime rate in Long Beach is 5.15 per 1,000 residents, which is all over both the California violent crime rate and the national median. This contributes to homicide and assault as one of the premature major causes of deaths. However, with alcohol and drug rehabilitation programs, as mentioned before, they hope to see a decrease in violence, crime, and hospitalizations due to alcohol misuse and substance abuse.
This is our reference slide, and thank you so much.